This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
All right, welcome everyone to the 21st Century Man podcast, where we break down, well, the essentials for the modern man.
That's right. Each week we're taking on a new chapter from this, frankly, brilliant book, also called The 21st Century Man.
Today we're diving into chapter 93, and it's a topic that, honestly, every guy needs to be informed about.
Yeah, sexually transmitted infections.
STIs. They can be a bit of an uncomfortable subject.
It can, but as the chapter opens with, "No one should die of ignorance," and when it comes to our health, that's truer than ever.
And that's where this chapter comes in. It was written by Dr. Judson Brandeis, a urologist, who really lays it all out there.
He does, and you were right to flag this chapter for us. It's full of crucial information.
It is, and our mission today is to unpack it all for you. We'll break down the key takeaways, decode any confusing medical terms, and really highlight what's most important for you to know.
Exactly.
One of the things that really struck me early on in the chapter was the data. It points out this kind of surprising trend. Even with all the awareness that came about during the HIV/AIDS epidemic, we've actually seen a rise in STIs since 2014. Gonorrhea and syphilis rates, for instance, have actually tripled in just 5 years.
Yeah, that's a pretty alarming statistic, and it makes this deep dive all the more timely.
Absolutely. So we're going to walk through the major STIs that Dr. Brandeis covers in this chapter.
We'll give you the latest stats, how these infections are spread, the potential impact on your health, and the available treatments. But most importantly, what you can actually do to protect yourself and your partners.
We'll tackle each one in the same order they're presented in the chapter, starting with human papillomavirus, or HPV.
HPV, probably one of the most common STIs in the United States.
Yeah, the chapter estimates about 80 million Americans are infected.
Wow.
And the real kicker here is the link to cancer. HPV is linked to roughly 35,000 new cases of HPV-related cancers every year. That includes cervical, vaginal, and anal cancers.
It's a pretty significant connection.
Okay, so let's unpack HPV a bit. First off, what exactly is it?
Well, HPV is a virus, specifically a double-stranded DNA virus. And there are over 100 different types of HPV.
100.
Over 100. They're categorized into types that cause warts and types that don't. And these warts can appear on your feet and hands, not just your genitals.
Okay, so how does it spread? The chapter mentions something called microtrauma. What does that even mean?
It's a fancy way of saying tiny breaks in the skin. You might not even be able to see them, but these microscopic abrasions are enough for the HPV virus to sneak in and infect the basal cell layer of the skin.
The basal cell.
That's like the foundation layer of your skin. So the virus takes hold there, causing the cells to multiply, and well, that's how you get those soft, flesh-colored, cauliflower-looking warts that are often associated with HPV. Then the virus replicates, sheds from these infected cells, and that's how it's passed on to sexual partners.
So even tiny little cuts or scrapes can lead to infection.
Yeah, that's the scary part. And you might not even know you have it.
The chapter also says that it can take a while for the warts to actually appear after you're infected, like 6 to 10 months, maybe even up to 2 years.
Yeah, it's a pretty long incubation period, and that's why regular testing is so important.
It also uses these terms, transient and subclinical. I'm not sure everyone knows what those mean.
Good point. Transient means the infection can be temporary. Sometimes your immune system can actually fight it off on its own. Subclinical means you're infected, but you don't have any noticeable symptoms or signs. You could be spreading it without even knowing.
That's wild. So are we saying people could have HPV and just never know it?
Definitely possible. Dr. Brandeis says that about 1 in 5 cases of warts will actually spontaneously regress, meaning they disappear on their own without any treatment.
Okay. But even if the warts go away, does that mean the virus is gone?
Unfortunately, not necessarily. Even after treatment, the virus can often persist in the body. And that means the warts can come back.
How often?
The chapter says recurrence is pretty common, happening in about 2 out of 3 cases.
That's a little concerning.
It is. And for some people, the risks from HPV are even higher.
Like who?
Well, people with weakened immune systems, for instance, are at greater risk of infection and also a higher risk of developing HPV-related cancers. That could be due to a medical condition, certain medications.
Makes sense.
And sexually active women are at a significant risk of developing cervical cancer from certain types of HPV. Dr. Brandeis really emphasizes this.
And that can be fatal.
It can. It's one of the leading causes of cancer deaths in women worldwide.
So what can you do about it? Are there treatments available?
There are. The chapter outlines several treatment options, starting with topical medications.
Creams and things like that?
Exactly. One type is trichloroacetic acid or bichloroacetic acid. These are applied by a healthcare provider every 1 to 2 weeks.
How do they work?
They basically destroy the wart tissue by coagulating the proteins in the wart cells,
Coagulating.
making them clump together. Essentially, they're burning the wart off. Then there's podophylox. That's a plant-based resin. You apply yourself twice a day for 3 days, then 4 days off. You can repeat that for up to 4 cycles.
And what does that do?
It works by stopping the wart cells from dividing, so eventually they die off. Dr. Brandeis says podophylox has a clearance rate of about 50%.
Are there other topical options?
Yeah, there's Seneca Tech ointment, which comes from green tea leaves. It's applied 3 times a day for up to 16 weeks. It's thought to reduce viral replication and decrease the inflammatory response.
Sounds interesting.
It is. And then there are immune modulators, like a Mickey Mod cream.
How are those different?
They work by stimulating your body's own immune system to fight off the virus and kill the diseased tissue. They can be a bit pricey, and they can also cause some side effects like pain, itching, redness, and so on.
How effective are they?
They have about a 25% clearance rate after 16 weeks.
Okay. So there are several options when it comes to medications.
There are, but one of the most important things you can do is get vaccinated.
The HPV vaccine.
Yes. Vaccines like Gardasil and Cervarix are crucial for both prevention and treatment of HPV. They're recommended for females aged 13 to 26 and males 13 to 21. Dr. Brandeis mentioned some really impressive data from Australia, where widespread HPV vaccination programs have led to a huge decline in HPV rates among young women.
That's fantastic.
It is. So talk to your doctor about the HPV vaccine if you fall within those age ranges.
Okay, so besides medication and vaccines, what about other ways to treat HPV? The chapter talks about cryotherapy, right?
Yeah, that's the freezing method, using liquid nitrogen.
That's what I always think of when I hear about getting rid of warts.
Right. It's pretty common. So they basically freeze the wart, then let it thaw, and might freeze it again. The size and thickness of the wart determines how many freeze-thaw cycles you need. Could be up to 3 treatments.
Does it hurt?
It can cause some mild to moderate burning during the treatment, especially if you have urethral warts inside the urethra.
Oh, got it.
Those require more extensive treatment.
Okay, so what's the recovery like after cryotherapy?
Healing usually takes 1 to 3 weeks. You might have some irritation, soreness, some mild pain, maybe some swelling, and shedding of the dead tissue. Sometimes it leads to sores or blisters as it heals.
Sounds kind of unpleasant.
It can be. Dr. Brandeis really stresses that you should call your doctor if you have any fever over 101 degrees, significant bleeding, any discharge, or if the pain just keeps getting worse.
Good to know.
And of course, you got to avoid intercourse until everything's healed up and the soreness is gone. That can take anywhere from 1 to 3 weeks.
Makes sense. So how effective is cryotherapy?
It's pretty good, about 90% successful.
Wow.
But you might need multiple treatments. And remember, you're treating the wart, not the virus itself. The HPV can still remain inactive in your system.
Okay, so cryotherapy is one option. What about laser treatment? When would you go for that?
Laser therapy is usually considered for cases where cryotherapy or topical treatments haven't been successful.
So kind of a last resort.
Not necessarily, but it's definitely more involved. One thing to keep in mind is that the smoke plume created during laser treatment can actually spread the virus.
Really?
Yeah. So both the doctor and the patient need to wear special respirators or use some kind of ventilation system to prevent that.
Wow. Okay. Anything else to consider?
Well, there's some concern that laser treatment might increase the risk of recurrence. The idea is that it might actually disrupt the local immune system, making it easier for the warts to come back.
Oh, it's a bummer.
Yeah, and just like with the other treatments, treating the warts doesn't cure you of HPV. You can still be contagious even after laser treatment.
And lastly, the chapter mentions surgical excision.
Right. For really large warts or when other treatments have failed, they might surgically remove the warts, either using electrocautery or a scalpel.
Electrocautery.
Burning them off.
Yeah.
But surgical removal is usually a last resort because it's more expensive and there's a greater risk of scarring.
Right.
Okay, so we've covered HPV pretty thoroughly. Ready to move on to the next STI?
Let's do it. What's next?
Chlamydia.
Chlamydia, another one that's pretty common, right?
One of the most common, actually. It affects both men and women and can cause some serious damage, especially to a woman's reproductive system.
What kind of damage?
Well, It can lead to pelvic inflammatory disease, which can make it harder to get pregnant. It can increase the risk of ectopic pregnancy.
Ectopic pregnancy?
That's when the fertilized egg implants outside of the uterus.
Oh, wow.
Yeah, it can be life-threatening.
The chapter throws out some big numbers when it comes to chlamydia, something like 1.7 million cases in the U.S. in 2018.
Yeah, those are the CDC's estimates. And it's especially prevalent in the 20 to 24 age group. About half of the cases are in that age range.
I guess that makes sense.
It does. Dr. Brandeis points out that your susceptibility to chlamydia actually decreases as you get older. For people over 40, the number of cases is only about 1/10 of what you see in younger adults.
Interesting. So how does chlamydia spread?
Through sexual contact, primarily. Vaginal, anal, or oral sex with an infected person. If you do develop symptoms, they usually appear 5 to 10 days after exposure. But here's the thing. You can get chlamydia again, even if you've had it and been treated before.
Oh, great.
Yeah, not ideal. And the only surefire way to prevent it is to abstain from sexual activity altogether.
Right.
But short of that, consistent condom use can significantly reduce the risk, especially for men.
What about symptoms? Are there any telltale signs?
That's the tricky thing with chlamydia. Most people, maybe even the majority, don't have any symptoms at all.
Really?
Yeah, so it's often called a STI infection. But even without symptoms, it can still cause those long-term problems we talked about.
Especially for women.
Right. Pelvic pain, infertility, ectopic pregnancy. That's why regular testing is so crucial. You can't rely on symptoms to tell you if you have it.
So what if you do experience symptoms? What should men be looking out for?
Well, in men, common symptoms include a discharge from the penis.
What kind of discharge?
It could be mucus-like or watery or even kind of a white, yellow, or green color. You might also have a burning sensation when you urinate.
And what about rectal infections?
Those can be asymptomatic too, but if you have symptoms, it might be pain, discharge, itching, or bleeding.
Okay, so how do you get diagnosed and what's the treatment?
Diagnosis is usually done through a simple urine test. And treatment, thank goodness for antibiotics.
So it's curable.
Yes. But here's the important part. Because reinfection is so common, Dr. Brandeis really recommends getting tested again about 3 months after you finish treatment, even if your partner was also treated.
Okay, so it's treatable, but you can get it again.
Exactly. And you definitely want to avoid any sexual contact until both you and your partner have completed the full course of treatment. If it's a single-dose treatment, wait 7 days after taking the medication.
Got it. And if you don't treat chlamydia, what are the risks?
In men, it can lead to epididymitis.
Epididymitis.
That's a painful condition affecting the tubes attached to the testicles. It can also lead to infertility, though that's rare. And in very rare cases, it can spread to the bloodstream or even infect the joints.
Yuck.
Yeah. And for women, the risks are even more serious. Untreated chlamydia can cause pelvic inflammatory disease, which can lead to infertility, ectopic pregnancy, and chronic pelvic pain. If you're pregnant and have chlamydia, it can also cause complications like miscarriage, premature birth, or even damage to the baby.
So early detection and treatment are really important.
Absolutely. Don't mess around with chlamydia. Okay, ready for the next one.
Yeah, what else do we have?
Genital herpes.
Oh boy, another one with a bit of a stigma attached to it.
It does, but it's important to remember that genital herpes is incredibly common. Dr. Brandeis says that over 50 million people in the U.S. have it.
50 million?
That's about 1 in 6 adults between the ages of 14 and 49.
Okay, so what causes genital herpes?
It's mainly caused by the herpes simplex virus type 2, or HSV2, but it's important to note that the frequency of outbreaks can vary a lot from person to person. Some people might have outbreaks frequently, while others might have them very rarely or not at all.
So how does it spread?
Through sexual contact, primarily. Vaginal, anal, or oral sex with an infected person. The virus can be spread through contact with the blisters, genital secretions, or even just skin in the genital area.
So you don't have to have visible sores to spread it?
No, and that's one of the main reasons it's so prevalent. You can actually spread herpes even when you don't have any symptoms. It's called asymptomatic shedding.
Asymptomatic shedding?
Yeah. It means you're shedding the virus without even knowing it. You could be contagious and have no idea.
Okay, so what can you do to reduce the risk of transmission if you do have herpes?
The chapter talks about a few things. Taking daily antiviral medication like a cyclover can really help. It can reduce the frequency and severity of outbreaks and also make it less likely that you'll pass the virus to your partner. Consistent condom use is also extremely important. Studies have shown that it can reduce the risk of transmission by up to 96%, and male circumcision might offer some protection as well.
Interesting. What about the symptoms? What are the typical signs of a genital herpes outbreak?
The majority of people with genital herpes actually have very mild symptoms or no symptoms at all.
Seriously?
Yeah. And even if there are blisters, they might be mistaken for something else, like an ingrown hair or a pimple. So a lot of people with herpes are completely unaware they have it.
Okay, so if symptoms do show up, what do they look like?
Well, you'll typically get one or more tiny blisters on or around the genitals, rectum, or mouth. These blisters will break and turn into sores, which can be pretty painful.
How long do the sores last?
They can take a few weeks to heal. Yeah. And you might experience some tingling, itching, or burning in the area before the blisters actually appear.
Like a warning sign.
Exactly. And during the first outbreak, you might also have some flu-like symptoms like fever, body aches, and swollen lymph nodes.
Okay, so you mentioned that outbreaks can happen again and again.
Yeah, that's the unfortunate reality of herpes. Once you have it, the virus stays in your body for life.
So there's no cure.
Not yet, but the good news is that recurrent outbreaks are usually shorter and less severe than the initial outbreak.
Okay. And over time, the frequency of outbreaks tends to decrease for most people.
Right. So what about treatment?
Yeah, what can you do to manage the outbreaks?
Antiviral medications are the go-to treatment, acyclovir or valacyclovir. They can help the sores heal faster and prevent new sores from forming. Taking daily medication can also reduce the risk of spreading the virus to a partner.
Okay, so medication is key. What about diagnosis? How do you even know if you have it?
Doctors can take a sample from the sores to test it.
A swab, right?
Yep. Or they can do a blood test to look for antibodies to the herpes virus.
So you can get tested for herpes.
Yes. It's important to talk to your doctor about it if you have any concerns.
Good advice. Now, the chapter also touches on oral herpes. What's the connection there?
Oral herpes is usually caused by a different type of herpes simplex virus, HSV1.
So there are different types.
Yes, HSV1 and HSV2. Oral herpes typically causes those cold sores or fever blisters on or around the mouth. Most people get exposed to HSV1 in childhood or young adulthood.
How?
Through non-sexual contact, like sharing saliva. And most people with oral herpes are either asymptomatic or just get occasional cold sores, maybe when they're stressed or their immune system is down.
Well, you said it can be connected to genital herpes.
Yes. You can actually get genital herpes by receiving oral sex from someone who has oral herpes.
Oh, I see. So you got to be careful there.
Absolutely. It's important to be aware of the risks.
The chapter makes it clear that you can't get herpes from toilet seats or bed sheets or stuff like that.
Right. Herpes is spread through direct contact with an infected person, not through inanimate objects.
Okay, so we've covered herpes pretty well.
I think so.
What's up next on our STI tour?
Gonorrhea.
Gonorrhea. I know that one can be serious too.
It can. It's another bacterial infection that affects both men and women and can infect the genitals, rectum, and throat.
And how common is it?
The chapter cites an estimated 1.1 million new cases every year in the U.S.
Wow. Is it more common in certain age groups?
Yeah, the highest rates are in people aged 20 to 24. And for men over 40, the incidence is much lower than in younger men.
So how does gonorrhea spread?
Primarily through sexual contact,
Yeah.
vaginal, anal, or oral sex with an infected person.
And it's easier for men to transmit it to women than vice versa.
That's what the chapter says.
Okay, so once again, abstinence is the only way to guarantee you won't get it.
Right. But condoms can significantly reduce the risk.
What about symptoms? Are there any warning signs for gonorrhea?
Some men don't have any symptoms at all.
So another silent infection.
Exactly. But if you do have symptoms, it might be burning during urination or a discharge from the penis.
What kind of discharge?
It can be white, yellow, or green.
And what about rectal infections?
Those can also be asymptomatic, or they can cause discharge, soreness, itching, or bleeding. Symptoms usually show up 2 to 7 days after exposure.
Okay. How is gonorrhea diagnosed and treated?
A urine test is usually sufficient for diagnosis,
Okay.
and treatment is with antibiotics. But here's the really concerning part. Gonorrhea is becoming increasingly resistant to many of the antibiotics that used to work.
Oh, no.
Yeah, it's a growing problem.
Like a superbug.
Kinda. We're talking penicillin, tetracyclines, macrolides, even some of the newer cephalosporins. There's a real risk that we could be facing untreatable gonorrhea in the future.
That's terrifying.
It is. So what are the risks if gonorrhea isn't treated?
Yeah, what can happen if you just ignore it?
In men, it can lead to epididymitis, which can be extremely painful. It can also cause infertility in rare cases. And it can even spread to the bloodstream or infect the joints, though that's pretty rare.
Okay. And for women?
For women, it can lead to pelvic inflammatory disease, which can cause infertility, ectopic pregnancy, and chronic pelvic pain. If a pregnant woman has gonorrhea, it can also lead to serious complications, including miscarriage, premature birth, and even damage to the baby.
So again, early detection and treatment are essential.
Absolutely. Now, moving on to another one that has some serious historical baggage. Syphilis.
Syphilis, that one's always sounded scary to me.
It is scary if left untreated. Syphilis can actually stick around in your body for years and cause some really serious health problems down the road. We're talking dementia, blindness, heart problems.
Wow.
Yeah. After being nearly eliminated in the U.S., cases of syphilis are on the rise again. Over 115,000 new cases in 2018.
A resurgence of syphilis. That's not good.
Not at all. And the majority of new cases are among gay and bisexual men, especially younger men.
So how is it transmitted?
Through direct contact with a syphilis sore, which is called a chancre. Usually during sexual activity, vaginal, anal, or oral. These sores can be on the genitals, anus, rectum, lips, or mouth.
So anywhere you might have contact during sex.
Right, and sometimes the sores are painless, so people might not even know they have them.
Okay, and the chapter says that syphilis progresses in stages.
It does. There's primary syphilis, which is marked by the appearance of the chancre at the site of infection.
So that's the first sign.
Yep. Then comes secondary syphilis, which can involve a skin rash, swollen lymph nodes, and fever.
So it starts to spread.
Right, and then it goes into a latent phase where there are no symptoms. This phase can last for years, but the bacteria are still in your body, doing damage silently.
Oh, man. And then what?
Eventually, it can progress to tertiary syphilis, and this is where things get really serious. It can affect the brain, heart, and other vital organs. We're talking dementia, blindness, heart failure.
That sounds awful.
It is, but the good news is that syphilis is treatable, especially in the early stages.
How do you treat it?
With penicillin. A simple injection of penicillin can cure it.
An injection.
Yeah. But the key is to catch it early.
And how do you do that?
Get tested. It's the only way to know for sure if you have syphilis. And if you do, get treated right away. It's curable, but you can get it again. Having syphilis once doesn't make you immune.
Okay, got it. So early detection and treatment are crucial.
Absolutely. Now, moving on to hepatitis, Chapter 93 covers 3 types, A, B, and C.
Hepatitis, that's a liver infection, right?
Yeah, hepatitis viruses cause inflammation of the liver, and that can lead to all sorts of problems. Hepatitis A is usually a short-term infection, while B and C can become chronic,
Chronic.
long-term, meaning you have the virus for life.
And there's no cure.
Not for hepatitis B or C, but the good news is there are vaccines for A and B.
So you can prevent them.
Yes.
Oh.
Dr. Brandeis really stresses the importance of vaccination.
Who should get vaccinated?
For hepatitis A, he recommends the vaccine for men who have sex with men, people who use drugs, folks with chronic liver disease, anyone in close contact with someone who has hepatitis A, and travelers going to areas where it's common.
Okay, that makes sense. What about the hepatitis B vaccine?
That one's recommended for anyone who's at risk of getting infected, like folks who have unprotected sex with an infected partner or people who have a history of STIs. Gay and bisexual men are also at higher risk for hepatitis B, so vaccination is particularly important for that group.
Okay, what about hepatitis C?
Hepatitis C is a serious one. It can cause long-term liver damage, cirrhosis, liver cancer, even death.
Wow.
Yeah. And there's no vaccine for hepatitis C yet.
So how do you prevent it?
Well, it's primarily spread through contact with infected blood.
Blood, yeah.
Like sharing needles or equipment for injecting drugs is a major risk factor. It can also be transmitted through sexual contact, though it's less common than hepatitis B.
Yeah.
And non-sterile tattooing or body piercing can also spread it.
Okay, so you need to be really careful with anything that involves blood.
Absolutely. You can't get hepatitis C through casual contact like hugging or kissing or sharing utensils.
That's good to know. What about symptoms? Are there any warning signs?
About half of people with hepatitis C have a mild illness that only lasts a few weeks, but for others, it can develop into a really serious long-term problem.
Okay, so what should people be looking out for?
The symptoms can be pretty general, like jaundice, poor appetite, stomach upset, vomiting, fever, dark urine, light-colored stool, joint pain, fatigue. Sometimes people just have chronic fatigue or depression.
And those can last for years.
Yeah. And the problem is, this chronic liver damage can develop slowly and silently over decades, often going undiagnosed until it's too late.
So you might not even know you have it until it's a serious problem.
Unfortunately, that's the case for many people. That's why regular checkups and testing are so important.
Okay. And how is hepatitis C diagnosed?
The initial screening is usually an antibody test.
An antibody test.
Yeah, it checks for the presence of antibodies to the hepatitis C virus. If that test is positive, then they'll do an HCV RNA test to see if there's an active infection.
Okay.
And there's also a nucleic acid test, or PCR test, which can detect the virus's genetic material in the blood.
So there are a few different tests.
Yes. It's important to talk to your doctor about which test is right for you.
Good advice.
Yeah.
Well, I think we've covered hepatitis pretty comprehensively.
Yeah, I think so.
What's the last topic Dr. Brandeis covers in this chapter?
HIV prevention.
HIV. That's the virus that causes AIDS, right?
Right. And Dr. Brandeis actually starts this section with a personal reflection on the early days of the AIDS epidemic.
He was there for that.
Yeah, he was living in New York City during those really scary early days of the epidemic.
Must have been terrifying.
It was. He talks about how little was known about the virus back then and how quickly it was spreading, and how it took years to identify the virus and figure out how it was transmitted.
And then even longer to develop effective treatments.
Exactly. He remembers when Magic Johnson was diagnosed and how that was such a huge deal because back then, an HIV diagnosis was basically a death sentence.
Yeah, I remember that too. But things have changed so much since then.
They have. Now, thanks to medical advances, HIV is a manageable chronic disease. People with HIV can live long, healthy lives and protect their partners from getting infected.
That's amazing. So what's the current state of HIV in the U.S.?
According to the CDC, there were about 38,000 new HIV diagnoses in the U.S. in 2018.
38,000. That's still a lot.
It is. And there are an estimated 1.2 million people living with HIV in the U.S.
And Dr. Brandeis mentions that a lot of people don't even know they have it.
Yeah, about 14% of people living with HIV are unaware of their status. That's why testing is so crucial.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.